Velindre's radiotherapy department is situated at the back of the hospital where parking is available. Please go to the main reception and hand your letter to the receptionist, who will take your details and show you where to sit. There are different types of treatment machines at Velindre. Most patients have their treatment on machines called linear accelerators, shortened to LINACs or LAs. Each LA is numbered and has its own smaller waiting area. On your first day, one of the reception staff or a radiographer will show you to your machine and explain where you will need to wait each day for your treatment. Once you have been shown to your appropriate waiting area, one of the radiographers will take you to a more private area to talk to you about your treatment. The radiographer will check your ID, provide you with a list of all your appointments and explain the daily treatment routine and possible treatment side effects. You are able to ask any questions you have to relieve any worries about starting your treatment. If you need to change into a gown for your treatment, you will be shown where our changing rooms are. During your treatment, you may be asked to have routine blood tests. These can be done in the main outpatients department. Some patients may have chemotherapy with their radiotherapy. This can be given in several different ways, and if it's necessary for you, your doctor will explain this to you before you begin your treatment. Radiotherapy does not hurt or cause any pain. The machine will make a buzzing noise, but you do not see anything. You are not radioactive after treatment, so you do not need to avoid children and pregnant women. Hair loss will only occur in the area we are treating. When the radiographers are ready to give you your treatment, you will be asked to take a seat in the sub-waiting area just outside the treatment room. Every day prior to treatment, the radiographers will check your ID to avoid any confusion. You'll be treated by 2 radiographers, and there will often be a student radiographer working with the team. If you don't want a student to be present, then please let your radiographers know. You'll be asked to lie on the treatment couch, and the radiographers will begin to set you up into the position required for your treatment. We will explain what we need you to do. The area of your body which needs to be treated will be exposed to allow us to align your tattoo dots with the laser lights in the treatment room. The radiographers work together to ensure that your position matches the one you were in when you had your planning CT scan. It is important, once you are in position, to remain still, breathe normally and stay as relaxed as possible. The machine will move around you, and the radiographers check various measurements against your treatment plan to ensure that everything is in the correct position for your treatment to begin. The radiographers will tell you when they are leaving the treatment room to switch the machine on. You must continue to remain still and breathe normally. The radiographers will be just outside the treatment room, watching you on cameras at all times. Treatment can be stopped at any time if you have any problems. You can signal this to the radiographers by raising your hand, and they will come into the room. Radiotherapy is quick to deliver, with each treatment beam usually taking less than a minute. Your treatment plan may have a number of different beams. The radiographers will move the machine from outside the room, stopping at the different angles. They may come back into the room to make alterations or take routine X-ray images during your treatment. It is important for you to remain still until the radiographers tell you they have finished your treatment. Once your treatment is finished, the radiographers will come back into the room and begin to move the machine and lower the treatment couch. They will tell you when it is safe for you to sit up, as the couch will be quite high off the ground. The treatment delivery process is the same every day and usually takes about 10 to 15 minutes, so you'll soon get into a routine after the first few days. During the course of your radiotherapy, you may have some extra appointments arranged to see our specialist review or information and support radiographers. You'll be asked to wait in the main radiotherapy reception for these appointments. Your appointments to visit our review clinic are arranged usually after your first week of treatment, as this is when any treatment side effects are likely to begin if you do experience them. You will be closely monitored during your treatment, and the review team can provide appropriate advice and any prescriptions, dressings or supplies that you may need to help you cope. Information and support radiographers are also available during your treatment to provide additional advice and practical financial or emotional support. You can ask to be seen by these professionals at any point during your treatment. There are other types of radiotherapy treatment available at Velindre. These include brachytherapy and DXR treatment. You'll be given more information about these treatments if needed. On your last day of your radiotherapy, you'll be given details for your follow-up appointment with your doctor. This can vary depending on your cancer and the doctor looking after you. Once you have finished your treatment, if you have any concerns or worries, you can contact the specialist review team. Their telephone number is provided on your follow-up form.